Now, the thought of studying for NCLEX is very daunting for many of us. After tutoring students and also hearing some of the questions I received in the past and some of the current ones, there is always one question I feel like students always ask me, and that is, how do I study for the NCLEX? How did you plan out your study schedule? So I want to address some of these issues with you guys today. And for this first part video that I'm going to be doing is going to be a brief overview as to how I study for the NCLEX, what are the materials and resources I study off of, what are some of the techniques I use to take my notes, and also a calendar for you guys for those of you who are having troubles finding a system that works for you. Now, as you can see by the title, this is a part 1 video, and mostly this is just an overview video, but for the future parts I plan on maybe doing more in-depth videos, so stay tuned, because I think especially for those of you who are having trouble staying on a schedule or finding a system that works for you, those videos would really benefit you, because I'm most likely just going to guide you through. And welcome back to Nursing Unveiled. Here we uncover all the tips and tricks on how to jumpstart a successful nursing career. Alright, let's start with resources and materials I really recommend. So the first one would be your Saunder's comprehensive review book. I know a lot of videos suggest this, and I'm going to do the same because it is really a great comprehensive review guide. In the later parts of this video, I'm going to explain to you exactly why it is such a great review book, but for now, just know that in your head that that is a great one. Second of all is going to be Uworld platform for your practice Q-Bank questions. That platform does a great job for practicing questions, but at the same time make it very convenient for students to actually study on the go, and also reading just rationale in general, because the way how they structure it, it's really easy on the eyes. Also, if you want to know some more details to Uworld specifically, I do have a video on that. It is called Kaplan or Uworld, and you will see that in the link up here and also in the description box down below. I'll link that for you guys if you guys want more information on that one. Next up is mobile apps. Mobile apps are great if you're always on the go and you need to just try to get some studying in while you're out doing your errands or whatnot. The app, I actually utilize it a lot when I was on traveling before I took my NCLEX, and I also have a video on that one as well. If you're interested, I will also link it in the description box down below and also up here for you guys if you're interested to see how I juggle with traveling and also studying for NCLEX. This next one is highly underrated, but I think it is probably one of the most important ones, and that is your own notes. Your own notes from the previous semesters and quarters that you have been in the nursing program. Those notes are actually probably going to be your most looked over. There are many times I actually went back to study my own notes to supplement some of these topics that I had a hard time understanding. So that was great for me because I know exactly why certain puzzle pieces were actually not connecting together. And with studying my own notes, I was able to make those connections. And this is really important, and I would talk a little bit more in later parts of this video, but for now, just note that you want to actually study off of your own notes more than the prep book, in my opinion. Lastly, you want to create a study binder for your NCLEX material. So what this binder is going to help you is towards the later part of your study, you're going to have an easier time reviewing back on material rather than trying to dig through all those notes that you've been looking over. And instead, it will give you a very quick snapshot and a summary as to what you need in a way that makes it work for you, because not everybody's going to need the same amount of information. So with having your own notes, that is going to save you a lot of time when you need to just review as quickly as you can towards the later part of your NCLEX studies. Just to give you an idea, for me personally, I actually studied majority of the notes from my own notes first as my priority, actually, before even jumping into any test prep books. So that was the way how I really study for this NCLEX. Now, I know for some of us are really pressed on time and that might not be the case. So I will also have a calendar for you guys to give you an idea as to how I would go about it. As I was mentioning before, you don't want to, memorize note by note when it comes to studying for NCLEX. And this is what some of the prep book does, is that they just bullet point you bullet by bullet. And sometimes that doesn't really work for people because you need to make some connection for you, especially if you're trying to answer any SATA select all that apply questions. That doesn't really come to you if you're just trying to memorize bullet by bullet, because it takes a little bit more of an understanding for you to actually get those questions correct. So this is one of the prime reasons why I actually study my own notes first. And also the Saunder's book is going to help you with that portion of studying. So Saunder's, highly recommend for a prep book. Now, I just want to make sure I say this. None of this that I'm saying is being sponsored. So these are really just how I feel, because this is a common mistake, and that is a lot of students, when they study these prep book bullet by bullet, everybody say the same thing, and that is, I end up forgetting what I studied. And that is because nothing really sticks to you when you're trying to study bullet by bullet. You have to try to have some sort of a connection, something to relate to in a bigger sense, so that it makes sense to you how each part of the puzzle fits together. So let me give you an example. Let's take changes in cardiovascular system during pregnancy. During this time, a female's blood volume increases by about 50 to 60% during her pregnancy. And as a result of this increase, it puts the body in a state of physiological hemodilution. So what that means is that because there is so much blood volume, when you take that sample of blood, it mimics a lower amount of HNH, which is hematocrit and hemoglobin. So that's why the lab result will show a lower volume in hematocrit and hemoglobin. Versus trying to just memorize, okay, in pregnancy changes in cardiovascular system,
a female's blood volume is going to increase around 50 to 60%, and hematocrit and hemoglobin is going to be low.
So you see how that's going to be harder for you to connect rather than actually understanding why that happens. The reason why there is a lower HNH is because there has been more blood volume. Now imagine it is having like more water and the same amount of sodium in a beaker. So when you're trying to take a sample of that beaker, what you're seeing is there are less particle from that beaker, but however, that's not actually the case. It's just that there's been more dilution that happened. So that is what's happening inside the female's body. It's just that there's much more fluid volume, and that in a sense dilutes the HNH. So we see why you want to understand the bigger picture is because you're able to connect all these different pieces together, and that is what you need in order to answer some of these bigger SATA questions. And just in general, it will save you a lot of time when you're studying, when you're able to retain the information longer rather than just trying to memorize it for this certain period of time and then realizing that you're just going to forget it much quicker as well. Now on that note, because you are going to definitely forget some of the things you studied especially in the very beginning stages when you're studying for NCLEX, that is why you have to create a binder and your own notes in order to go back to it a lot easier when you are trying to review everything that you have done for this NCLEX. Now this is an overview video, but if you want more details as to how I go about creating my own binder and how I go about using that material, leave a comment down below so I know to possibly do that for a future video for you guys if you want that. Alright, for this next part of this video, I'm going to talk about how you should study for the NCLEX in terms of how you schedule yourself to study. Now this is a big problem for many people because it's very hard for people to get motivated to study for NCLEX, and especially for almost this marathon of studying. So let me give you an outline as to what I did and also some of the suggestions that you should do if you are trying to study for NCLEX, because based on what I've been seeing, this type of outline tends to work for many people. So to give you an idea, I started studying about maybe 5 to 6 months for my NCLEX, and the reason for this is because we needed to study for our Kaplan Predictor in my final semester of nursing school. And the reason why is because if we do not pass that exam, then basically we do not graduate from the nursing program. So this was one of the major reasons why I had to study that far in advance. Now, of course, Kaplan Predictor is mainly geared towards Kaplan material. With that said, after my Kaplan Predictor, I actually needed to do a little bit more studying to actually gear myself towards NCLEX more. This is when I actually start to use Uworld platform, specifically for about a month or so. Now, the way I study is in the first month, I use that time to look over concepts from my patho and med search notes in the past for big concepts like maybe like cirrhosis, COPD, any cardiovascular diseases, and also any endocrine disease. Endocrine, it's probably one of the biggest ones that is covered in general on the NCLEX, so really gear into endocrine systems diseases. And from there, I would take notes on a separate piece of binder paper on just big characteristics of that disease and diagnoses, along with maybe like treatments and medications that are more specific for that diagnosis. And in the meantime, I'll just set those notes off to the side, and that is what you're going to use to actually create your binder. After that month, it was really just doing practice questions after practice questions every single day. I think I probably did about 50 to 75 Q-Bank questions every single day and remediated right after that. So that is the bulk of my study, which is within 2 months, to be honest, for my Kaplan Predictor. Now, the same can be said for your NCLEX studies in that similar format. And I know everybody's life is pretty different. Some of us are a lot more pressed on time, so some of us are going to take the test within a month time. So I have an example calendar here that I will show you as far as how you could go about maybe studying for your NCLEX in a similar regard. So in general, this is an outline that worked for many people. In the first week and a half, you want to dedicate that time to med-surg and critical care, then maybe about 3 to 4 days to pediatric, and after that you want to go into maternity for 1 week. After that, you want to give another about 1 to 2 days, depending on how you're feeling, on mental health. And for that last week or so, you want to just dedicate fully to reviewing everything that you have done up to this point, including doing 2 mock tests in that time frame for your review. In terms of how you should study pharmacology, you can do this by actually sprinkling it throughout your study period. So for each day, I would probably do about 10 pharmacology questions, strictly pharmacology questions, on top of the 30 questions that I would do for practice each day. If I were to study at the very minimum in that 1 month period that I would have, that is how I'm going to go about it. And as for Saturdays and Sundays, that is going to be when I do a full-on 75 question test along with remediating that information to see how much I actually retain that information that I study off of throughout the week, and also making sure I practice consistently, so it does not be a surprise when you're trying to study everything towards the end for practice questions, because it doesn't really work that way. This is what's going to actually help you improve your score on your NCLEX, because by knowing the rationales, you will know exactly why that answer is wrong, and that will prevent you from making those same mistakes in your future practice questions or test. Now, let's say you have 2 months time to study for NCLEX at the very least, which is what I highly recommend, is actually giving yourself at least 2 months period to study for the NCLEX. So in this case, what I would do is dedicate 2 full weeks to med-surg and critical care, then about 1 week for maternity and 1 week to pediatrics, and also about maybe 3 to 4 days for mental health. So for those 3 to 4 days, make sure you dedicate time to looking over a lot of psychiatric medications, because psychiatric medications are known to have really bad life-threatening effects as well. So those life-threatening effects, they are also tend to be asked on NCLEX as well. So make sure you really study pharmacology aspect of mental health along with, some of the bigger psychiatric diseases. Another aspect to mental health that you need to study on are actually substance abuse. Substance abuse tends to be asked also when it comes to NCLEX, so study on that as well. Now, looking at the schedule, we can tell why a 2-month period is ideal to study for your NCLEX, and that is because the first month is really dedicated to really reviewing a lot of those concepts and topics that you have forgotten over the nursing school years. And then after that, that is when you can really try to prep for your NCLEX, which is practice questions after practice questions after practice questions and remediations and rationales. Now, with that said, a 1-month period is definitely doable, but however, I would think it is very overwhelming, especially if you feel like you have forgotten a lot of topics and concepts over the years. So that is why I would say give yourself at least 2 months period if you can. Next, I want to go into study strategies, and some of these I kind of touch based on what we were talking about. But first and foremost, your Saunder's book is great if you have, say, you run into a question that you really do not know the concept to, or you have completely forgotten what it is about, and even after reading remediations and rationales you still do not get it, then definitely go back to your Saunder's book to read up on that section. And this will give you a really good overview and some of the missing pieces that you need in order to make those connections for you, along with maybe looking into your own notes if you have your own notes that are good enough to explain that to yourself, because I know that for some people their own notes sometimes does not do it for them because it's been a while. And this next tip that I'm going to give you is very important, I would say, and that is really do not rush through reading rationales, because no matter how pressed on time you are, if you do not understand something, then you are never going to understand. So actually take the time and remediate and look over your notes, do all those things to make sure you understand it, because by the end of the day your scores is going to stay the same if you don't understand something. And with that said, skip the stuff that you do know. So really put your time into stuff you just don't know, and focusing on that is going to be a lot more beneficial for you in the long haul. And next up, I just want to reiterate what you are taking notes on when you are studying for NCLEX in general, and that is you want to know what are the big characteristics in signs and symptoms, especially for those diagnoses. Then you want to look into what are the specific treatments and medications that are used for that diagnosis. Then you want to look into lab values. What are big lab values that you should be noting in order to, just identify that most likely this diagnosis is happening to us because of these lab values that are given to us. And last but not least, any major procedures that are in association with this diagnosis. Now, when it comes to remediating, I want to stress that you do not want to actually put your remediation notes together with your NCLEX notes. The reason why I say this is because when you are trying to say, look back on a question, that specific question and that specific note, you don't want to actually go through all those pages of notes that you have in your binder that are, mixed together with everything. So it's a lot easier for you to find that information back if you actually separate the two. Alright, so those are my tips on how you could start prepping for studying for NCLEX, or if you have already started studying but you just needed some more guidance, this is how I would go about it, and hopefully this will work out for you. Let me know in the comments down below what other tips and topics that you guys like for me to go over next, and along with what are some of the tips and topics that you have experience with that really worked out for you. I mean, I'm sure other people would love to hear what you have to say. And as always, if you like this video, please give it a thumbs up, hit the notification bell, and also subscribe to my channel. I have new videos every week, so stay tuned. Bye!